Hi, welcome to Pink for a Reason. And today we are going to talk about a chemical very important for your health as a woman, which is called hormones. And when we say hormones, what does it mean? It means that they are chemicals, okay, that regulates, okay, or coordinates different functions in your body, right from the blood to other parts of the, being your organ, being your skin, being your muscles and other tissues in the body. And the first organ we are going to look at, the common one most of you know already, is estrogen. When we say estrogen, what does it mean and what is its functions? It's important, and when they are less or higher than normal ranges, what happens, what they causes. So estrogens, they are just the, their primary means they are the main, okay, female hormones produced mainly by the ovaries. They are produced by your eggs, okay. And what they do is that they regulate your menstrual cycle. So the estrogen is responsible for regulation of your menstrual cycle. They support your support uterine lining inside your uterus, okay. The lining inside, they support it, and they maintain bone health and skin elasticity. So your estrogen is for what? For regulation of your menstrual cycle, for a healthy bone and a skin elasticity, okay, and the uterine lining. Now let's see, when you have excess estrogen, what does it cause? So in excess, it make you gain a lot of weight, okay, and it also causes heavy menstrual bleeding. It causes fibroid and also causes endometriosis. We've done fibroid, we've done endometriosis. And if it is deficiency, means if we are having less, what does it cause? It causes what we call hot flashes. When I say hot flashes, it means that you feel warm. Sometimes when you sleep, you sweat. There's this kind of warm temperature that you have because you are having deficiency of what? Of these estrogen. Then there is vaginal dryness. Your vagina is so dry, which causes what? Pain during during sexual intercourse. And also osteoporosis or porosis. Osteoporosis, it means that the mass and the density of your bone has reduced. Your bone has a specific mass and density. When it reduces, that's what we call the osteoporosis. And that is why some women, and your pelvic, they start you start to have pain over it because the bones there are what? Weakened. The masses there has what? Reduced. Let's go to 2. We have what we called progesterone. We've done estrogen. We have progesterone. What does it mean? Progesterone hormones, okay, they are hormones that produce what? Ovulation, to prepare and maintain pregnancy. So progesterone produce after ovulation. Your progesterone, they produce after what? Ovulation. They prepare and maintain what? Your pregnancy. So let's see its importance. So its importance or function is that it prepares your uterus, okay, for pregnancy to occur. It balances the estrogen that is produced, and it also supports pregnancy. When you get pregnant, that progesterone support it. Now let's see when it is excess. When it is excess, it causes fatigue, it causes bloating in a lot of air in your stomach, and it causes what? Depression. When it is deficient, what it causes, that it causes miscarriage and PMS, meaning premenstrual syndrome, and also causes irregular menstrual cycle. Now let's see some diseases that when you are having a problem with the progesterone, it can cause infertility, it can cause miscarriages, recurrent miscarriages, and it can cause amenorrhea. Amenorrhea means absence of what? Menstrual period. So you see, these hormones are very, very important as a woman. Then we look at the follicle stimulating what? Hormone, that is FSH. Most of you know about that. Now it's being produced by your it's a pituitary hormone that stimulates egg development. Your FSH, okay, the follicle stimulating hormone, it's what? It's a pituitary hormones that stimulate egg development. It means it helps the development of your egg as a woman. pituitary means it's a part of the body, the small portion of the body is inside your body. It produces what? That hormones. Now let's see its functions. It is crucial for puberty. That is when you are starting to develop that adolescence. Okay, and it's also for sexual development and fertility. So this particular hormone is very vital and important as a woman. When it is excess, what it causes ovarian failure, it causes menopause. Now when it is deficient, what it causes the absence or irregular period. Now problems or diseases associated with this stimulating follicle, if you have deficiency, it's related to what? PCOS, polycystic ovarian syndrome. I've already explained that. That's when you're having excess male hormone. Then infertility, then vaginal insufficiency. So these hormones are very, very important. Hormone 4, which is luteinizing hormone. That's LH. We have FSH, So luteinizing hormone. It's also a pituitary hormone that triggers ovulation. So the LH, it triggers the ovulation. It causes the ovulations to happen. And its function is that it stimulates ovulations and progesterone production. Progesterone, we've said that is very important for your pregnancy. So this LH, it stimulates that progesterone production and also for ovulation, as already said. When you're having it excesses, it causes PCOS. So you can say PCOS is a lot of hormone dysfunction causes PCOS. So it's very important. It's common with women. Then premature ovulation failure, premature ovarian failure. When you're having deficiency of it causes infertility. So you see that all these hormones causes infertility. So they are very important as a woman. Then let's go to related diseases of these ones. They are related to PCOS, very common, amenorrhea, absence of your menstrual cycle. Then hypogonadism. So these are the kind of diseases that they are related. Hormone 5, gonadotropin releasing hormone. And these gonadotropin are releasing hormones. They are hormones from the brain. Okay, they are from your brain. That's what signal the pituitary to release FSH, follicle stimulating hormone, and the LH. So this gonadotropin hormone is very, very important. They are inside your brain. Okay, that would stimulate your pituitary gland to release this. They causes your pituitary gland to release the FSH and the LH, and all these hormones are very important as a woman for your fertility. Now, essential or importance or functions, they function for reproductive hormone balance. They help your reproductive hormone balance. When it's excess, it causes early puberty. So at a younger age, you could see that somebody is already menstruating at an early age. Then if it is deficiency, it delays your puberty and your fertility. It causes infertility. You get it? Now, let's see the disease related. We have hypothalamic amenorrhea. We have Kallmann syndrome. Kallmann syndrome, is a genetic disorder characterized by delay or absence of puberty due to hypogonadotropin. So if you are having a problem with the gonadotropic tropin releasing hormones, it can cause a lot of problem as a woman. Number 6, which is prolactin. Prolactin is a hormone from your pituitary gland. So the pituitary gland is very important when it comes to women's health. Okay, and after the pituitary gland is part of the brain, it's small portion of your brain, inside the brain. Okay, so it's a hormone from the pituitary gland that stimulates breast milk production. So the prolactin is for your breast milk production. So this video is to help you the functions of your hormone and what they do as a woman and its importance to you as a woman. When it is excess, it is irregular period, infertility, and so you have irregular period, you have infertility, and we have the galactoria. Then let's see if it is what? Deficiency. If it is deficiency, you have poor milk supply. There will be poor milk supply. Let's see the diseases related to it. We have amenorrhea, absence of your menstrual. A lot of women faces this kind of problems, absence of menstrual period. A lot of ladies faces this, and you need to take or pay attention to that. Let's look at testosterone. Somebody will ask, why women have, or does women have testosterone? Yes, women has, but a small amount. If we have any excess, it has a problem. So it's a male hormone, also present to women for a smaller amount. I've already explained that. It helps you, support libido. Libido is is part of your body, or the hormone, okay, that helps you to get interest to have sex. That's the libido, the urges to have sex. Okay, then the bone and muscle health and ovarian function. Now, if you have an excess of these, because remember, this testosterone is a male hormone, but women have it small amount. If a woman having it large amount, you have PCOS. So it's see that you have a lot of hair. Some women have a lot of hair, sometimes on their nipple area, navel area, their face, their chin, a lot of hair. So it's very, very important hormones, but when it is a lot, it causes what? Problem. Now, if you're having deficiency, of course, you're going to lack or lower, so you're going to have a lower libido. So your interest to have sex will be limited because your libido, the urges to have sex is low. They have fatigue and bone weakness. So these hormones is very important. Okay, now let's look at hormone 8. That is the thyroid hormone. That is the T3 and T4. So the thyroid hormone, okay, is a hormone from the thyroid gland regulating metabolism. Metabolism in your body, talk about the fluid parts in your body. Okay, so the metabolism regulations is done by your thyroid hormones. Now let's see, it influences menstrual cycle, ovulation, and fertility. So consider these hormones are very, very important for your fertility as a woman. If they are excess, they produce hyperthyroidism. So then you can have absence or light period, or weight loss, or anxiety. A lot of women faces this a lot, anxiety. Then deficiency, if it's not hyper, it will be hypo. So hypothyroidism. Now, so you have a heavy menstrual period, weight gain, and a fatigue. When it is hyper, you have absence or small amount of period and weight loss and anxiety. When there's hypo, which is low, so it's low, you are going to have a heavy menstrual period. You are going to gain a lot of weight. You're going to have fatigue, easy fatigability. That's you easily get tired. Disease related is infertility, miscarriage, and menopause. So please, you have to take note of that. Next, number 9, last but one, anti-Mullerian hormone. So the anti-Mullerian hormone, that we call it the AMH, is a hormone that makes your ovary reserved. Okay, that's the egg supply. So they make the ovary reserves. Now it helps to assess fertility potential. It helps you to assess your fertility potential. When it is high or excess, it often causes PCOS, polycystic ovarian syndrome. When it is low, it normally give you a low ovarian reserve or aging. Helps you to cause aging at early stage. Then disease related, we have PCOS already mentioned, infertility, and ovarian aging. Your eggs will be growing older. Next, on the last one, we are having the woman chronic gonadotropin. Human chronic gonadotropin. That's the HCG. This hormone is very, very important in women. Okay, so it helps to, we use it normally to detect pregnancy. Now, pregnancy hormone made after fertilization. So it's a pregnancy hormone. It produced normally when fertilization has taken place, or when you are pregnant. Now, it maintains early pregnancy by supporting progesterone. So it maintains early pregnancy by supporting progesterone. Now, warning, Abnormal level, when it's abnormal level, it causes ectopic pregnancy, miscarriages, molar pregnancy, disease-related pregnancy loss. Because you're having ectopic pregnancy, of course, that baby cannot be, cannot develop. You have to remove it. Then gestational trophoblastic diseases. So these are your hormones, 10 hormones. We have the estrogen, progesterone, prolactin, gonadotropin, follicle stimulating hormone, luteinizing hormone, woman chronic gonadotropin, the HCG, a lot of them. You need to, they are very important for your health as a woman. Very important note, hormones are invisible. They are invisible, okay, and they are a houses of women's health. They are invisible, but they are the major vital or an important source of women's health. Balance is the key. When it's balance is the key, because it must be balanced. Okay, when it's excess, it causes problem. When it is low, it causes problem. Too much or too little, that can lead to conditions like PCOS, infertility, fibroid, thyroid diseases, and pregnancy complications. So we must take care of our health. Now, it is important that you go to the hospital to check your hormonal level. You can go to the hospital. The doctor can help you to check your hormonal level. Okay, so you can go to the hospital to see your gynecologist and tell him that you want to check your hormonal level, to check your fertility level and all those things. And the doctor will help you run those tests and help you to find out how your hormones are doing, how they are functioning, and how your fertility levels are. My name is Dr. William. I'm pink for a reason. Thank you so much for listening. Bye-bye.